Hi, welcome to my channel. I'm Dr. Pranav and today in this video I'm going to share the learning approach that can help you to grow your practice faster. Please note that this video is particularly for the students who are about to complete or recently completed the dental graduation. If we speak about the current scenario of dentistry in India, you would agree that just completing the dental graduation doesn't make you confident. One has to continue learning and upgrading skills to be successful. But unfortunately, very few youngsters pay attention to this particular part. And I am saying this out of my experience of organizing over 200 dental events. I have observed that majority of the dentists willing to learn have 5+ years of practice. So in other words, most dentists take 5 years to understand that they need to learn and upgrade their skills, and then they regret that I should have learned this earlier. I understand that some dentists may have financial crunch in the initial days of practice, but don't worry, we are going to discuss that as well. Now, first let's talk about what to learn. Most dentists focus on learning clinical skills, but remember, it's not enough to run a practice. You also have to work on other aspects like your communication skills, your practice management, marketing skills, and there is no end to learning. And it's not necessary that you have to spend heavily on all these things. You can even read books on improving your communication skills, marketing, etc. There are plenty of such books available under 500 rupees. In fact, I am writing a book on dental practice marketing. I'll make the link available in the description below once it is published. Another problem that I found is random learning. Like I mentioned earlier, we have been into organizing dental training programs like endo, prostho, ortho, implants, composites, etc. via the website dentistfriend.com. And we keep on getting inquiries. We get calls like, I'm doing my internship now and I want to pursue my career in cosmetic dentistry. I want to join digital smile designing, or I want to learn veneers. Someone who started practice couple of months back in maybe a rural location wants to join advanced implantology workshop. See, I'm not discriminating anyone. My only suggestion is one should go for the right thing at right time. Having clarity about what you wish to do is good, but you also need to follow the correct path. If someone is willing to enroll for a workshop, then it's an opportunity for us to earn money. But at dentistfriend.com, our primary objective is to help and guide you genuinely and not money. Unfortunately, not everyone is like us, and many dentists end up wasting their time and money by joining workshops which are presently not relevant to them or their practice. But I hope after watching this video, you won't make such mistakes. Now, before moving forward, let me tell you that I am not into clinical practice, but I have attended multiple workshops right from endo, FMR, fixed ortho, implants, and so on. Probably I would not have been able to attend so many workshops if I would have been into practice. Also, I work as a consultant for several dental practices and I have a clear understanding of what works and what doesn't work. I mentioned this purposely, otherwise someone would come and comment that Pranav, you are not even in practice, and what makes you teach us what to do and what not to do. I hope this explanation would be enough for all such comments. Alright, so if you're a dental graduate who is about to start your own clinic or started recently, the first 3 skills that you should give priority includes endo workshops like rotary endo or anything in endo. The second includes your basic prostho workshop like crown and bridge preparation, dentures, etc. And the third and most important is your basic oral surgery workshops like automatic extraction, suturing, etc. You can decide the sequence as per your suitability, your interest and priority of learning. But make sure you go for any of these 3 basic workshops before jumping for any other learning. Now, some of you might say, I'm interested in cosmetic dentistry. See, if you have done your post-graduation in the respective branch, or if you are a second generation dentist, then you may have an option to follow your interest right from the beginning. But if you are the first generation dentist with no PG, then it's very rare that you will get an opportunity to work as a cosmetic dentist in someone else's clinic. Also, in the initial days of practice, patients won't come to you directly or exclusively for cosmetic dental treatments. It's my observation that more than 50% of patients consult majority of dentists in India for complaints like toothache or missing teeth. Of course, there always will be some exceptions, but it's better you improve your RCT, crown and bridge, and extraction skills and play safe. Now, once you are confident with your basic clinical skills, your very next workshop should be on dental practice management. Remember, it's not only the clinical workshop that matter, but how you communicate with your patients, how you handle your staff, how you manage your finances is equally important. And unfortunately, this is not taught in dental colleges. The early you learn the management aspect of practice, better are the chances of your growth. Once you are done with practice management, you should consider learning occlusion. Yes, occlusion. See, what we learn in colleges is definition of occlusion and maybe reducing high points from the crowns, which is not enough. Occlusion is a complex topic. It's usually covered in full mouth rehabilitation workshops designed for partially edentulous cases. Now, if you tell your seniors that you are attending FMR workshop, they laugh at you. They might say, if you don't have an FMR case, why are you learning it? But remember, this is the most important aspect for giving a holistic treatment plan and a long-term treatment to your patients. FMR workshop is recommended not only for treating FMR cases, but also for your basic treatments. Let me tell you something. If you don't maintain the occlusion properly, none of your cosmetic corrections are going to last long. You can even confirm this from mentors who conduct workshops on cosmetic dentistry. Even they will tell you the same. So before going ahead with any workshops like composites, veneers, digital smile designing, you should first consider FMR. Now, once you are done with all the basic learnings, you can proceed for any other workshops like implants, ortho, lasers, digital smile designing, or anything as per your interest and affordability. Now here is one more thing I would like to mention. If you are introducing any new treatment modality in your location, then you have chance of becoming the leader for that particular treatment in your city or wherever you practice. But remember, introducing any new treatment is likely to take more efforts, time and investment to get acceptance by the patients. And sometimes this might go against you. I'll tell you how. Dentistfriend.com also has the option where you can resell your used equipments, and I frequently come across posts where someone is selling implant kit. What do you think? Why this happens? See, these dentists try to introduce implants in their location. They learn implant courses, buy implant kit, invest in physio dispenser, but then there is low treatment acceptance by patients. Now, if the investment made to introduce or learn implants, if that becomes a financial burden, you have no option than to sell it off. So whatever you choose to introduce in your practice, make sure to do it wisely. Now there are further questions like, Pranav, from where should I learn? How much should I spend in learning? How many times should I learn the same thing? Let me answer this one by one. So the first question, under whom should you learn? Now I have two suggestions here. First, don't go blindly for the name. There are various conferences that happen around you where these mentors take lectures at nominal charges. Attend these lectures, listen to them, see if they are able to connect and understand whatever they are saying. It will give you some idea whether you should actually learn from them or not. And the second suggestion, don't go for mentors qualification. Someone who has done 10 implant cases and is trying to teach you about implants, don't go for it. Go to somebody who experienced failure, because in clinical practice, what not to do is more important to understand than what to do. So choose a mentor who is passionate about dentistry, who is passionate about teaching, and who can be available to guide you whenever you are in need. Now coming to the second question, how much should you spend on learning or upgrading yourself? See, in the initial days of practice, you might experience financial crunch, but I suggest to invest as maximum as you can. Alright? Because it is one of the things that's gonna help you grow faster. Now coming to the third question, how many times should I learn the same thing? Well, let me tell you that learning something from one mentor will not be enough. You'll have to continue learning and refining and brushing your skills. For example, if you learn marketing from me, maybe by watching my videos or reading my blogs, and even if it works for you, that's not going to be enough. You have to learn it from others as well. We never know if you will get a valuable insight that I did not cover from somebody else. If you follow this learning approach, you are very likely to grow fast without wasting your time, efforts, and money. Hope this video will be of great help for you. Happy dentistry. See you on the other side.